Welcome to UNIQACARE Talks, a podcast where we talk about anything related to healthcare and medical tourism and how these two work together flawlessly. Our goal is to answer questions about any type of medical procedure from cardiovascular to organ transplant and more, and also raise awareness about how much charities matter to save a human life, and also share stories that we have encountered along the way to build understanding and empathy. I am your host, Mehmet Küpeli, the founder of UNIQACARE Clinic. I have been working in this industry for a decade now. I'm a young entrepreneur and an ambitious humanitarian who works with charities to provide healthcare to so many kids who need but cannot access. I am excited to talk about today's topic. Okay, let's talk about kidney transplantation. Kidney failure is a very common disease that unfortunately affects many people's lives. Kidney failure can be treated with modern medicine. If the patient has lost kidney function, they must either receive lifelong dialysis treatment or have a kidney transplant from a cadaver or living donor. Kidney failure is not a cause, but a result. It can be caused by many different diseases, but the most common causes are diabetes, hypertension, nephritis, systemic lupus, and serious infections. When these diseases cause chronic kidney failure, it eventually reaches the fourth stage, also known as the final stage, and the kidneys can no longer perform their essential functions. Unfortunately, this is a condition that cannot be reversed with any medical treatment. At this stage, we recommend that all patients to have a kidney transplant and take advantage of the surgical treatment, which is now widely used and has a high success rate. Of course, patients who have not yet had the chance to have a transplant must be periodically monitored by a nephrologist, and dialysis treatment should be regularly applied to compensate for kidney function loss, especially in the end-stage patients. Kidney transplantation is a very comfortable surgery that takes about 3-4 hours and is followed by 1 or 2 days of intensive care unit stay. And after the patient is transferred to the ward, and after 1 week or 2 weeks of inpatient follow-up, is discharged and undergoes a 2-3 week rehabilitation period that is continued with outpatient follow-up. The most important issue is finding the right donor. Cadaver donors are the first option, but unfortunately there are few donors and the waiting lists and time is very long. So patients are mostly transplanted from living donors. In addition to this, the practice in Turkey and many developed countries is that only cadaver donors are available to the benefit of citizens of the country, which also requires foreign patients to be transplanted from living donors. To be a donor, both medical and legal qualifications are required. Legally, the donor must be a first, second, third, or at least fourth degree relative of the patient, or a close friend who can be proven to the Turkish Republic authorities. Medically, blood group compatibility is required. Every patient can be transplanted from their own blood group, and all blood group donors can donate to all blood groups. A B blood group can receive kidney donations from all blood groups as well. Second, the donor must not have any disease that can affect kidney function. For example, a person with diabetes, hypertension, nephritis, hematologic or oncologic disease cannot be a donor. The donor must definitely undergo a very detailed checkup before the transplant. However, if it is determined that they do not have a disease that threatens their health, they can be a donor. Finally, the recipient and the donor must undergo a group of tests to check for compatibility. Other than the blood group, there are also some criteria to find out if the donor and the receiver are compatible. With these high-level laboratory tests, such as HLA and cross-match, it can be determined whether the donor's kidney and tissue structure are compatible with the recipient. This process is fully compliant with international standards and is the key to the success. This minimizes the chance that the transplant kidney will not function normally, which result in a success rate of almost 100%. The most common question is whether being a donor will cause any negative effects or loss of function in a person's life, in the short or the long term. Kidney transplantation was first performed in the United States in 1950s, and in the last 20 years it has become very common, with almost 100,000 patients undergoing the surgery worldwide each year. These transplants, which are 75% performed by living donors, also allow for the monitoring of the medical condition of donors after the transplant. As you all know, medicine is a science based on experience. This high data shows that the risk of developing kidney failure in the future for a person who has donated a kidney is less than 100% compared to a normal person. It should not be forgotten that kidney failure is not a cause but a result. Therefore, a person who has a disease that can lead to kidney failure unfortunately faces the prospect of losing both kidneys when they reach to the final stage. It has been proven by long-term medical and academic experience that being a kidney donor is not a threat to a person's health. After the transplant, the donor can resume their normal life within 7 to 10 days. They can exercise after 1 month. Apart from the painkillers they will use for a few days after the surgery, they do not need to take any medication for lifetime. And there is no special diet plan they need to follow. The donor's kidney function can be fully performed with a single kidney, and they can do any kind of work, continue their reproductive functions normally, do heavy work, and even play professional sports. The transplant team consists of nephrologists and general surgeons. In addition, gastroenterology, cardiology, and various internal medicine specialists are also involved in the process. The general process is as follows. First, both the recipient and the donor must undergo detailed medical tests, and then they are made ready for transplantation after the compatibility tests are completed. This process takes a total of 3 or 5 days. When all tests are completed, the transplant team evaluates them, and if nothing is wrong, the transplantation surgery is performed a few days later. After the transplant surgery, the recipient is followed up in the hospital for about a week and then continues to be followed up on an outpatient basis for 1 month in Turkey. The recipient must take certain medications for a lifetime. It is necessary to regularly monitor for kidney functions. It is recommended to follow up every month for the first year and every 3 months for the next year. This follow-up process consists of some basic blood tests. We have made it a principle to maintain lifelong contact with all our patients and to be constantly by their side. This process, which may seem very complex, is a very effective treatment method for kidney failure patients, with a total of 2 weeks in the hospital and the remaining month being followed up outside the hospital and with clear standards and expectations. Despite all these informations, you may still have some questions about us. We will be delighted to answer them. Therefore, please do not hesitate to contact. Do not hesitate to send your questions via our Instagram, UNIQACARE, or via our email, consultation@unicacare.com, or via our WhatsApp line. Our area code is +90 and the number is 551-099-3282. This podcast is available as a podcast and also on the UNIQACARE YouTube channel. You can also leave your questions and suggestions below in the comment section on the YouTube channel. Our official website is UNIQACARE.com. This was your host Mehmet Küpeli. Thank you for listening to me and see you next week on the next episode. Wishing you all a great week.